I would. Thank you very much.
Hi guys, this is Charles. I'm one of the surgeons at Southpaws. Today we are doing hopefully a liver lobectomy in a little 12-year-old dog that has a large right middle liver lobe tumor. Dog presented with a history of a bit of lethargy and anorexia, and then they did, and also polyuria, polydipsia, ravenous appetite. They did blood work, and that revealed elevation in liver enzymes, and then did an ultrasound, and that showed a large liver lobe mass. They did an aspirate on the liver lobe mass, and that revealed probably a benign liver lobe tumor. And so we've done a CT scan today, which confirmed a right middle liver lobe tumor, and no evidence. I was concerned about the possibility of Cushing's disease, given the fact that it was polyuric, polydipsic, and polyphagic, with elevation of liver enzymes. That could just as well be an adrenal gland tumor. And so CT scan failed to show evidence of adrenal gland tumor. And so we've gone in with the intent of removing it surgically. And it does go quite far cranial and is abutting the vena cava cranially. And so we'll just have to make sure that we can get it out without posing too much risk to the dog. If you haven't already done so, please subscribe to our channel. Make sure that you turn on notifications so that you'll get a little ding on your phone the next time we live stream. Hopefully, I will live stream a mast cell tumor in the caudal thigh later on today, so just keep your phone close by if you'd like. So we're doing our midline incision, and note that we're going quite far caudal, just to make sure that we're getting adequate exposure. And we'll go in, and as always, we always take out the falciform fat to increase our visibility. No problem. Yeah, go ahead and give some. If you're watching this live and you have any questions, you can post them on the live chat. Try to get to them as soon as we can. We can see that mass poking out there. Can I get a bow 4, please? Great, thank you. And, yes, it is. So I'll quiz you guys. What's the most important prognostic factor with liver lobe tumors? Most important one is grade. They're graded 1, 2, and 3. And with grade 1s having a median survival time of about 2 to 3 years, grade 2s are about 12 months, grade 3s are about 2 to 6 months. So there's a question, is it possible that we will have to remove the liver? And the answer is yes, well, hopefully we will. Hopefully it's one that we will be able to take out. So next important thing with abdominal exploratories is to use bow 4 retractors. Really important because it's going to increase your exposure significantly. And I'm extending my incision all the way up to the xiphoid, and we can see that tumor sticking out there. And then we're going to use our spoon, which acts as a centralizer, but we have to be careful because this mass is going to be friable. So we don't want to traumatize the tumor with the spoon. So that's the tumor sitting there. It's quite large, right-sided. Not sure if that's going to come out or not. All right, so just lift up on that. So we'll just have a look at the stomach here. And we've done our CT scan, so we know that there are not any obvious tumors anywhere else in the abdomen, but we'll still have a good look. So looking at the pancreas there, coming down, looking at the right kidney. Don't know if you guys can see that because it's a big dark hole. Coming around the caudal duodenal flexure. It is tricky to exteriorize the caudal duodenal flexure because of the duodenal colic ligament. And then we're running the jejunum now. Heart rate's going up. I'm just letting our anesthetist know that the heart rate's coming up a bit, and so we're going to have to give up probably another fentanyl bolus. So just running the bowel here.
Yes, thank you.
Spleen. And then looking at the adrenal gland on the left side sitting right there. And then kidney there. So, and we'll start getting a better look at this mass, seeing if we think that it'll come out. Now there's a trick that you can do if you're not getting adequate exposure, is that you can create a pneumothorax, and that'll allow the liver to fall back caudally. All right, so I've got my gallbladder there, common bile duct there. And how much normal liver would we have if we took out that whole lobe? Not a lot. Can I save that bit of liver? I've got a big blood vessel up against the tumor there. All right. So there's vena cava right there, and the mass is right up against the vena cava. So just see if the lights are as bright as they'll go. I think they are. I'm concerned that if I remove all of this, I'm not going to leave enough normal liver behind. I could come from that direction there. Yep, take your time.
You have to remove the gallbladder as well?
No, I can pull the gallbladder off.
So that's
We have a bit more liver down here that we can leave in.
the one lobe there and the two lobes there.
Yeah.
We need to take
But the vena cava is going right through the center of the tumor. All right, so I'll just start over here. So let's get this moistened. And the question is, what's the next best option if I can't remove the liver tumor? And that would be just to manage it conservatively. And animals can survive with liver tumors for an extended period of time. So I would not do anything heroic in an attempt to remove this thing. I'd rather it survive. Let's see here. So that's attached all there. I feel like if I'm going to do this, I should probably separate the gallbladder from the liver. It's just right up against the vena cava up here.
Yeah.
The vena cava is heading down here through the caudate lobe. I try to zoom this in a little bit in hopes that you guys will get a better view. So you can see the mass peeking out there. Watch your head. You can see the mass peeking out right there. Head's still in the way. So that's vena cava coming down there. That's not going to be easy. Just turn back here, just see how much liver we're going to leave behind.
It's like one lobe.
One lobe there.
One full lobe here and one full lobe there.
Yeah,
Two lobes.
two lobes. Yeah, kind of effectively one.
So three lobes.
I don't mind.
It's like 50% of the liver is okay.
Yeah, you can take 75% of the liver, and the liver does have some regenerative
Yeah.
capacity. So the question is the mass right medial and quadrate lobe, and that is correct. Yeah. I might try to separate the gallbladder off first. So let's just gently hold back on that liver there. Posh, why don't you hold there gently? And then, can I get that hook cautery tip, please? Just the hook cautery tip on the side there.
Opposite of when you normally do it. Liver's coming out,
Yeah.
the blood is staying.
You see how I'm going underneath the capsule? And that's the best way to keep the liver from leaking bile and bleeding too much. And I will probably remove this gallbladder as well. Can I get some gel foam, please? Maybe some 4.0 PDS, please. So question, do I follow up with chemotherapy? Probably not, because we think that this is going to be a low-grade tumor. If it did come back high-grade, we might consider chemotherapy. Yes, please.
And no parental drugs here in the liver surgery.
I beg your pardon?
And no systemic drugs for bleeding,
No, not right now, no.
vitamin K or something like that.
Look, we didn't do a clotting profile beforehand. Wouldn't have been a bad idea. Yep. I'm just putting a suture in the gallbladder so that we can retract it. All right, so we'll just retract like this. We don't yet.
You want me to retract this part?
No, that's. Retract on that gently, please. The whole point of what I'm doing is to try to free up the gallbladder from that recess back there. Can I get my loops, please? Thank you. I'll just pack this off for a minute while I wait for my magnifying loops.
How long will this take?
I don't know. Question of how long this is going to take, and I honestly can't tell you. So just take off my glasses. That's it. And just off with the glasses. On with the loops. Thank you. Okay. All right, so we'll get a right angle in here. Another right angle here to keep it from leaking when I cut it. Can I get some silk, please? Where's my Mets and bones, please? So gallbladder's out. And just lift up my right angle, please, just a little bit. And we have to be really careful not to avulse the common bile duct, because if we avulse that, we are in big, big trouble. Okay, you can release that now, please. Okay. Are we getting any blood in the bucket yet? Okay, great. So we're just monitoring our blood loss. This is not going to be easy at all. So that's all tumor there. We've still got vena cava down here. The vena cava is going right up to the tumor. I think we're probably going to have to call it quits. I don't think I'm going to be able to get this out. Okay.
Well, we get a gallbladder soon, huh?
Yeah. All right, so let's release that. Let's see what we got here. And the blood supply to the tumor is going right through that liver lobe, so I can't even preserve that. Let's see if I could cut through the parenchyma of the liver, like through here maybe. That guy, we can send that off as a liver biopsy. Yeah, I think I'm going to call it quits. I don't think this is going to come out, especially in a tumor that's probably going to be relatively asymptomatic. It's not worth risking the dog's life. So I think we'll leave as is. We should take a biopsy of it, though. So can I get a biopsy skin punch, please? 5. So we're just going to biopsy this thing.
Great.
Yeah. So there's a question about debulking. I'd be reluctant to do that only because it's gonna bleed. There are going to be big blood vessels in this thing, so I don't think I could effectively. I don't think that I could effectively debulk it without risking serious blood loss. So we're just taking a liver biopsy there. I'm going to make a little cigar of gel foam. Poke it in there. Put some pressure on it. Let's just, can I hand this off to you, please, to go in a biopsy pot? Hey?
Can I push down?
I can just hand it off for the moment. Don't worry about putting it in. Just hand it off, and then I'll come out and take it out. All right, so that's that, sadly. So you happy doing some 2.0 PDS in the Linalba? All right, so I'm going to come over and check the questions and make sure I've answered everything. You going to come around? Just keep your hands up between your, and don't touch your face. Sorry. All right, so So gallbladders come out. So question about intradermal suture pattern. So I do a side to side, almost like a vertical intradermal rather than a horizontal intradermal. That's the difference, and I can demonstrate it another time. I won't do it on this case, but it is a little bit different from how people normally do it. Let me just see if there's any. There is no special management for a dog that's had a gallbladder removed. There was a preliminary diagnosis of a probable benign liver mass. Yeah, that's about it. So anyway, I'm going to go ahead and discontinue the stream. I hope to live stream a mast cell tumor a little bit later on. So thanks everybody for watching, and hope to catch you again later on this afternoon.